If you have poor posture, have experienced trauma, have difficulty breathing, have digestive issues such as acid reflux, constipation, and IBS, fertility problems, menstrual irregularities, and cramping, have snapping hip syndrome, sciatica, back pain, leg pain, hip pain, bladder pain, or pelvic pain, your psoas is probably tight. Your psoas is a muscle that connects your lower body to your upper body. It runs from your lumbar spine, your lower back, into the front of your hip, connecting onto your hip bone, the lesser trochanter. Your psoas can tighten up due to your emotional state, your lack of movement, or too much repetitive movement in the hips. To release your psoas, place the ball between the pointy bone of your hip and your belly button. Gently lay on the ball and slowly apply pressure. It may feel like a sharp stabbing pain in your stomach going into your back. Try to relax as much as you can and focus on diaphragmatic breathing. Our psoas is involved in almost every movement that we do day to day. A tight psoas can cause stiffness in the hips and spine. Your psoas can pull your lower back out of alignment, either causing your back to arch or flatten, which then affects the rest of your spine. Since your lower back is out of alignment, it will affect how you walk and move. Your emotional state is also linked to your psoas because your psoas is the main muscle involved in the fight or flight response your body has. When you experience mental or emotional stress, your psoas tightens up. This is why if you've experienced trauma, your psoas is probably tight. Your psoas also affects your breathing because your diaphragm is linked to your psoas. A tight psoas can cause your ribs to flare out and change your breathing to quick, shallow chest breathing. If you're always in fight or flight, you never give your body and your psoas the chance to relax, which then affects your breathing. Lay on the ball for 2 to 5 minutes. You can do this 4 to 5 times a week, depending on how tight your psoas is. Remember that you can release the tightness in your psoas, but if your emotional state doesn't change, you don't increase your daily activity or change your style of training so that it's more balanced for your body, your psoas can tighten back up.